everyone. This is Julianna LeMieux coming to you from ASGCT for this second video check-in with my colleague, Kevin Davies here. Kevin, how you doing?
Hi, Julianna. Great to be here.
So we have been in, I would say the most striking thing is that we have been in a lot of amazing talks for the last couple of days.
Yeah, it's been good.
Amazing talks. So I will say I want to start with what was my favorite. Sometimes you just hear a talk, and this actually happened 2 years ago for me with Carolyn Bertozzi's talk at AACR, and it just goes into that's the best talk I've ever heard. Okay, so running in close contention to the best talk I've ever heard came yesterday morning in the opening or the big plenary session in the morning, and it was from Tippi MacKenzie at UCSF. I think you were there, Kevin.
I was.
Yeah. And it was this just absolute masterclass of storytelling, telling how she, as a young medical student researcher, chose to work on in utero, prenatal conditions, and how she's now spent her career and is still going so strong in her career, making inroads in that area. And she talked about, and this was the most striking thing I think for me, she's using just any host of different ways to try to both diagnose prenatal conditions and then also cure them while in utero. And so she talked about each of these: stem cell transplantation, and gave case studies of each of these, enzyme replacement, ASOs, antisense oligonucleotides, AAV gene therapy, and genome editing. And it was like one amazing story of science after another. And also in the morning session yesterday was a terrific presentation given by the winner of the Outstanding Achievement Award, Jeff Chamberlain, on his, again, decades of work trying to cure muscular dystrophy using AAV-mediated gene therapy, which they've made amazing inroads in as well. Yeah. So that was just amazing. And then I know that there was another big story yesterday morning.
Which Jen went to town on in covering, as did pretty much the entire scientific media and mainstream media.
Yeah, exactly.
So I'd love to spend a few minutes and get your reaction too, on how this all came about. When you in the run up to a big conference, you of course start asking your friends and colleagues, what are you expecting? What's the big talk going to be? And we were getting some hints from our friends at Danaher, the big corporation headquartered in Massachusetts, that there would be some big news that they were involved in, but they gave away no details, not even when this talk or talks were going to take place. But that had us on a little bit of alert. And then a friend of mine at the New England Journal of Medicine said, you should probably make a point of hearing this Musunuru talk in one of the plenary sessions, the George Stamm medal. And then we got word of a press conference, embargoed press conference 2 days before, or on the eve of the conference, which, because we were so busy getting ready for this, we couldn't attend. So we assigned our friend and colleague Fei Lin, Jen's new senior technology editor, to cover. And it's her story that's really the lead story on the Gen website. And we urge you to go and read that, which will give the full details. I'm just going to skip over some of these things. But the presentation yesterday was from Kiran Musunuru, who's a cardiologist by training at the University of Pennsylvania School of Medicine. And then this morning we heard another presentation, a companion presentation from his colleague at CHOP, Rebecca Ahrens-Nicholas, I hope I'm saying that correctly, a metabolic physician scientist who cares for kids with rare genetic disorders that focus on rare inborn areas of metabolism, specifically those affecting the urea cycle. So a missing enzyme called CPS1, which prevents this newborn from metabolizing ammonia. So ammonia builds up rapidly and can cause all manner of toxic symptoms. And it's the most serious of these disorders. And so when such an infant is diagnosed, you've got to try to keep them healthy to the point that they might potentially qualify for a liver transplant. Or, of course, you're sort of dreaming about some form of interventional gene therapy as you just try to manage the diet as best you can. And until the last 6 or 9 months, any kind of bespoke gene editing therapy has been a fantasy, an absolute fantasy. And now suddenly, in quite the sort of the lightning strike, we have a story presented this week and published in the New England Journal of Medicine and all these other media outlets that shows that we can design in just a matter of a few months. We can go from the sequence of a newborn infant with a very serious genetic disorder to designing a base editor, a custom bespoke base editor to fix this one mutation that will restore the full-length protein enzyme. You've got an interesting tidbit in the paper. You've got it as Rebecca mentioned today. You then have to give the child immunosuppressants because the infant has never seen this full-length protein before. So they were even worried that even if they could fix the gene mutation, there'd be other problems. And it was fascinating. Nicole Gordelli, who was the postdoc with David Liu, who developed this first of the adenine base editors, was sitting in the front row for Kiran Musunuru's talk. I'll mention Nicole at the end of our video chat here. So Kiran Musunuru, not a huge name for some, but we've been following his career with great interest for the last several years. He's a co-founder of Nava Therapeutics. The gene editing, publicly traded gene editing company looking to treat heart disease by lowering LDL cholesterol levels. He's also the author of a really excellent book, The CRISPR Generation, about all the controversy a few years ago about the CRISPR babies. And I loved what he said in his talk yesterday. How do we mitigate mutational discrimination?
Oh, yeah.
Ever heard that phrase before?
No, I hadn't. I really liked how he made that point. Yeah.
We need a patient-first approach, he said, for any variant in any patient, whomever, wherever they are. A bit of Shakira reference there. Each and every patient deserves a fair shot at this. And then he went on to tell this amazing story, which I won't go into great depth.
And actually, not only just, sorry if I can interrupt for a second, not just about that, how like we have to democratize this so that everybody can achieve it, but also the N of one design and development and production is so expensive that a lot of people in this field are talking about more platform-based technology.
Exactly.
So I think it's like brings up two different levels. Like, yes, we need to be able to make it for everybody and then bring it to everybody.
Yeah. The whole, So I think the reason for the excitement, some might say hype, but let's just say excitement. Sure. This story isn't that we've cured an infant. That's great news in and of itself, but that this is the first glimpse of the success of a true platform approach. But as Fyodor Urnov from the Innovative Genomics Institute said in a symposium yesterday, just before Kiran's talk, if we use these technologies now to cure one or two patients, we failed.
Right.
Which is a very, very stark and powerful thing to say. We've got to really realize the potential. This is something that this is a drum Fyodor has been banging now for several years. And I urge our viewers to read his spectacular editorial that he published in our sister journal, the CRISPR Journal, late last year, called Give Cas a Chance. Just Google Urnov 2024 CRISPR Journal. It'll pull it up. It's the whole, in 6,000 words, he lays out the framework for why this N of many approach has to work. Otherwise, the whole potential of CRISPR is missed.
But there's also you have to walk before you can run, right? And so it's like, there are people making bespoke N of one therapies. Yeah. And yes, there has to be a way to bring that to everybody, of course. But it's like these all, are celebrated because even that right now is a huge win for the community. We just need to think,
So the link between Musunuru and Urnov is that Urnov is the director of the IGI Danaher, I forget the precise name, but it's a public-private consortium that where Danaher really is able to leverage its expertise in cell and gene therapy because it has so many subsidiary companies, IDT, Aldevron, Molecular Devices, Leica, Cytiva, of course, that all play in this cell and gene therapy space. And Urnov and Jennifer Doudna, the Nobel laureate, and others saw years ago, that this outfit could potentially provide many of the key technologies to build this platform approach. And hence the confetti on the floor. Did you see that yesterday? One of those companies had a little party at the booth right as the New England Journal of Medicine embargo was lifted. Fyodor said that for 4 years ago, he wrote a utopian timeline, complete delusion of turning the timeline for going from a disease gene mutation to designing editors, all the testing, preclinical, to potentially the start of a clinical trial. Normally that would take 3 years. how can we get that down to 2 months? That was a utopian ideal, and now it's been realized. And I loved what Musunuru framed that. Yeah.
Yeah, it really was the speed that they did this, with which they did this. That was so incredibly impressive.
Yeah. ASGCT gave this star treatment, and so did the New England Journal of Medicine. They published 2 companion editorials along with the paper, including one from Peter Marks, formerly the head of the division of the FDA that really worked with this community to usher in these platform approaches. And Peter wrote in his editorial, although the results are very early, the approach taken by Kiran Musunuru and his colleagues shows the potential strength of the application of cutting-edge science and technology with a forward-leaning regulatory approach to safely expedite the development and availability of life science medicines. And I like what Rebecca Ahrens-Nicholas said just this morning, Julianna. It's possible now. We've shown to develop a personalized gene editing therapy in 6 months. And, a week ago, we would never have really imagined that was possible. But as she said in her closing comments, we need to move from N of 1 to platform trials, which is exactly the point that you were making.
Yeah. A lot of people have echoed that same sentiment over since they've become available.
Yeah. So a lot of excitement. I've mentioned the confetti celebration here on the floor. I think a few caveats as well, and definitely offline, off the record, speaking to a couple of people who raise inevitably some issues about just how scalable is this approach. One expert I spoke to, a leader in the gene editing field, does a back of the envelope calculation and says, I think this probably costs about $10 million. The Danaher Corporation and its subsidiaries made a amazing gesture, not just in personnel, but in helping to really fund this with in-kind support. How long that will continue remains to be seen. But this is very exciting.
Well, I think that's a story that we at Gen particularly would be really well suited to discuss and talk to the industry leaders, all the people that we cover and know, and say, what would it take actually to make a platform system, not just for development. That's like a whole, and that's been a lot of the discussion, the development of the drug. And that's hard and amazing that they did that. But what would it take to manufacture that?
Right.
And I think that's a question we should really ask now, going home and just kind of thinking about that a little bit. And I think we will.
Well, we'll mention a couple of programs at the end where I think we will. Exactly. Yes, so anyway,
we have
I know you've got a notebook full of notes here, Julianna. What else?
Oh yeah. Other talks. Yeah, the other things are going on. So, well, actually 2 talks from this morning I just want to highlight. The morning talks have just been amazing.
By the way, I went to get you a beignet, and then you tell me you don't eat these things. So, you'll know.
So kind. Yeah. Well, you'll just have to have a second one, and I'm sure it'll be hard.
But...
Okay, so one talk I perked up immediately because the speaker was Xavier Anguilla. And again, this was in the main session this morning, following Rebecca. And he's from Nava Therapeutics. And immediately I thought, okay, this is interesting because Nava was founded, or I think co-founded, and the CEO is our friend, Federico Mendoza.
Oh, yeah.
Who, and like with Xavier, they both, worked with Kathy High. I mean, these are gene therapy pioneers trained by the best and, have been through it in the AAV world specifically, right? They're 2 AAV gene therapy pioneers. Well, so Xavier's talk was amazing. So they've started a new company, Nava Therapeutics. So and I've been asking Federico, what are you up to? What are you doing? They've been in stealth mode and he hasn't said. So I thought, okay, now we're going to learn a little bit. And we did. So Xavier went through this amazing walk through some origin stories. The first was the zinc finger origin story, which was great. The second one, then he talked a little bit about AAVs, and then he talked about the LNP origin story. And he said, as an AAV biologist, but now working at LNPs, he said he's so excited. And he said he feels that, and this is a quote, a new chapter is opening for gene therapy with LNPs. And so what Nava is doing, this is the information that was given, is they're developing novel lipids, like a lipid chemistry, and then building LNP libraries, doing in vivo screening, and then screening those LNP libraries using single cell RNA, using spatial, using LNP tolerability, and then screening them using machine learning to basically develop LNPs that they can test and that could be used for many, many different applications. So I thought that was super interesting and can't wait to see what Nava is up to. I mean, it's a new company founded by gene therapy pioneers now working in LNP engineering. So that was super cool.
You interviewed Federico just for the last summit we did, right?
And he's been on Gen Live. Yeah. He's like amazing.
Right.
Amazing. Such a, and it has such a great background in all things gene therapy. Yeah. So really excited to see what Nava's up to next. Right. I'm sure we'll hear more. Yeah. And then the last talk was by Ben Deverman, who's at the Broad. And he told another great story about how in 2012, he was asked by Paul Patterson to develop an AAV vector that not just targeted the central nervous system, but crossed the blood-brain barrier. And so he kind of set out to do this and develop, found an AAV vector, which he named after his mentor, Paul Patterson. Actually, Paul Patterson died of glioblastoma just a couple months after the AAV capsid was identified.
Oh, wow.
So, and then he's gone on since that time to make a second generation, but then they found that the AAV capsid that they had identified was limited to a subset of mice. And this is like a big thing in AAV. It can work in mice and not non-human primates or vice versa or whatever. So then he went on to identify the receptor for the AAV and then engineered new capsids to bind to that receptor. And now they make AAVs that bind to multiple human receptors. They're crossing the blood-brain barrier, making huge inroads in that space. Also now working on ones that, would that you could use at a lower dose. And so you would have less problems with neutralizing antibodies, also engineering them around neutralizing antibodies. So just tackling a lot of like the major problems in AAV gene therapy. And then lastly finished that he works with Sonia Valab and Eric Valab-Minkle, who we interviewed Sonia on our last summit, along with that big collaboration you may remember from last year where they were making epigenetic editors with Jonathan Weissman's lab, David Liu, the Valab lab, and he's also, Deverman is involved in providing the AAV vectors that would deliver the treatments to the brain.
Valab spoke here. I missed her talk
yesterday. I already.
Of course, she's really looking for a cure for her own prion disease.
Yeah. So just totally inspiring, both the stories, that we've heard and also the science that's just been like through the roof.
Yeah. So how are we following this up? You've got Gen Live. You're going to do a debrief?
Yes. So I have my Gen Live show next Wednesday, just in a couple of days. And it's a post ASGCT wrap-up show. And I have 3 guests coming on. So Jeff Chamberlain, who we already mentioned, who won the Outstanding Achievement Award, Aravinda Sokon from Duke. And so, and we'll talk a lot of gene therapy there. But also I really wanted to talk about cell therapy, something we actually haven't really talked about.
Right.
But has been a huge part of ASGCT. And actually, there was another great talk this morning about cell therapy. So hopefully, so it's going to be a lot for her to cover, but Janelle Volkoff will be joining us as well to talk about, and she works specifically on cell therapy for autoimmune diseases, which has been I've seen many of the sessions like that.
That's a live 1 hour
live
debrief.
1 hour, you can come and ask your questions to the guests as well. And so we'll talk about everything.
And I also want to, before we sign off, plug the state of CRISPR and genome editing. It's the latest, the forthcoming Gen virtual summit. We do these every month or two. 4.5 hours of amazing talks from the likes of Feng Zhang from the Broad Institute. Yep. We'll have the co-developers of base editing, Alexis Comore and Nicole Gordelli. My God, they've got some really exciting applications to talk about. We'll have Beth Shapiro from Colossal Biosciences talking about dire wolves. Nothing to do with gene therapy, but interesting nonetheless. And Fyodor Urnov, perhaps, just bringing it back full circle to where we started this video, talking about the CRISPR Cures program, and now this really what we can call, I think, the first proof of principle of something he's been passionately advocating now for several years. So the same CRISPR and genome editing, June 11th, put that in your diary. It's 11 a.m. Eastern time. We hope to see you there. It's entirely free thanks to our sponsors.
Yeah.
And that's it.
I had home tonight.
Right.
And although most of our colleagues have been delayed, so
yes,
I'm hoping I get home tonight. But anyway, That's it.
There's also been a prison break nearby, so we have to watch out for that.
It's never a dull moment on these trips, but we've making it through, and it's been a great meeting and a pleasure to bring all of it to you. And so thanks for tuning in.
Can I have my beignet now?
Now you may have it.